everyone, well, welcome to another episode of Ask to Know Show. We love how this show has been going, how we've been receiving a lot of questions. And guess what? Today we have a very special question for you. We've invited Enough to come and join us to reflect all your questions and all your concerns that you've been sending in. You guys already know me. My name is Kitua Edward Balanso. Are we going in?
My name is Joshua Beatrice Jokwa, and I work with Modibo Adama University Teaching Hospital here in Yola.
We are happy to have you here, Nurse Joshua. So without wasting much time, we'll start responding to the questions right away.
Is asthma a disease? Is it transmitted from one person to another? Well, I would say asthma is a disease, and normally it's come as an inflammation to the respiratory tract, which it causes difficulty in breathing, and so many others. It's also transmissible, though it's through genetics. It can be inherited. If, for instance, a family member has the disease that's asthma, the offspring can come up with it.
Exactly. But it's not as in because I have asthma, you have asthma, we sit down together and eat.
That is not.
It's not like very transmitted. My menstruation is usually very thick, dark colored and slippery. Is it a normal type of flu or is there a problem? Well, it depends. Having a very thick, dark colored and slippery menstruation can be normal, especially if it is at the beginning or at the end of your menstruation. And slippery it's probably because it is mixed with the cervical mucus and all of that, you understand. But if you see that it is dark colored throughout your flow, it is common with heavy bleeding and very painful. Usually lasts more than 7 days, then you really need to go see a gynecologist or seek medical attention. But if it only comes in the beginning or at the end and it's not too frequent, it's normal.
As an adolescent, a guy, I see swelling around my private parts and it's hot and itch. Please, what can be the cause? Well, for your question, there are so many causes. There are so many causes to that. Swelling is more like a symptoms, It's not the real thing, not the real fact, it's the symptoms. So it can be, attributed to bacterial infection, yeast, and so many others. So many others. So I would advise, if this persists, you can consult a medical practitioner, go to the hospital, and then that will be, affected.
And also be as a result of irritation. And maybe poor hygiene. Please maintain a very high level of hygiene, especially when it comes to your private parts. Okay, I like this girl, but she's AS and I'm AS too. But we're actually trying to take risks because I see a future with her. What would you advise us to do?
And please see the future?
Yeah, the future. This is an interesting question. But the thing is, medically it is not advisable, right? AS and AS, when you do the whole crossing of the tree and all of that, you will definitely come up or give birth to a child that is sickle cell anemic. If you trust me when I say that in that future, when you have a child that is sickle cell anemic, it won't be worth it. So unless if you don't want to have children, you can take the risk. But medically it is not advisable, and at the end of the day, you will come to realize that it is really, really not worth it.
It says, good day. I want to ask what causes vaginal itching, because I experience a lot of itching, though I do not use public toilets or dirty underwear. Well, using a public toilet or dirty underwear will not certain to that fact, But I would say mostly the causes of itching can be the things we wear. Those things we wear, the clothing, the scent product we use, perfume, and sometimes as we said earlier, clothing too, dirty clothing
Yeah, I agree.
can also add the hygiene, can also cause that itching.
For females, right, when it comes to the private part, please sometimes allow your private part to breathe or cure. I know that it is good for you to wear all the underwears and everything, but at least once in a while, just allow it to breathe. Look at the pad, yeah. Just the breathe or cure. It's very, very important. I tracked my period last month. My period came on the 4th of March and ended 3 days later. It has started again on the 28th. Is there anything wrong? Well, there isn't necessarily anything wrong with the date of your period changing. You understand? Sometimes period you can experience period twice in a month, and some of the factors could be stress, or the hormonal changes.
Hormonal imbalance.
Yeah, imbalances.
Not in a proper way. It's definitely present.
Yeah, double period a month, right? Yeah, but then if it is something that comes with other factors, maybe itching or maybe, and then it lasts more than 7 days, you understand? There are other things that you know that this is not normal, then you will need to go see a gynecologist. So we've got to the end of our Ask to Know show for today. Please keep the questions coming in, and hopefully next week we'll have a medical doctor join us to answer your questions. So please keep them coming and keep them rolling.